Hey guys, this is Greg with Medical Muscle. In this video, I want to talk about the shelf exams in year 3 and my tips to help you guys, because there's certain things that I wish I did differently and the things that worked very well, and also things that worked well for my fellow students that did well. So let's get into it. So your shelf exams are going to be anywhere between 6 or 12 weeks, depending on the specialty. So everything other than surgery or medicine is going to be 6 weeks. Those two are 12 weeks. So you have that much time to study for these shelves. There's a lot of content. Some of these shelves are a lot harder than others. I'm going to say psych was relatively manageable. I don't want to say easy, because I don't think that's fair for people who struggle with it, but I think it's the most manageable of these. OBGYN was tough. Peds was very tough. There's a lot of content in 6 weeks. I think that's what makes it hard, because it's a mixture of medicine and just peds in general. It's just difficult. Each stage of life brings different challenges, okay? Medicine is, I feel like it's very straightforward relative to a lot of the other shelves, because SGU really gets you ready for that shelf exam. And they should, because medicine is the biggest part on step 2. And then surgery is its own beast. So let's just talk about how you're going to study for these exams, just in general. So you're going to go through all your UWorld questions, all right? Now, that might seem obvious, but a lot of people don't complete all the questions that they can. I'm not saying that you won't do well, but you should. Because there's always some weird question that the NBME is going to ask. And if you just haven't studied that one weird thing, or have seen the question presented in that way, you're not going to know, okay? So that's just a heads up. It's just getting that volume in. Now, I would also suggest not only completing all the shelf UWorld questions, but getting through all the NBME questions you can get your hands on. So I know some people use the older NBMEs. I think they're helpful, because then you get to see how NBME shapes their questions. They're different than how UWorld shapes their questions. And sometimes the first line is different between the testing companies. And you need to be able to know why. You need to recognize that there are differences in what they think for specific situations. Now, I know that some people have access to older NBMEs. Just be aware that the older ones may have content that they're not using anymore, or something might be wrong, because in medicine, we always learn that, there's always updates, there's always new first lines, and you want to make sure to get the most recent first line for a specific treatment or whatever. So make sure that you're up to date with the newest stuff. There might be something that's no longer correct. All right, so just know that. So you've done all your UWorld. You've done all the NBMEs that you can get your little hands on. What I would suggest, and this is what I wish I did, was to start working on the step 2 dedicated stuff in UWorld. It's the other tab on that specific topic, okay? Now, in my other videos, I always said you should save step material or UWorld material if it's for dedicated step stuff. Now I think I think this is a good argument. I don't think you should save anything. The reason being is that you probably won't. Most people, even people who did really well in step 1 or step 2, didn't complete every single question. So don't worry about going through those questions, because you may not actually get through all of them, even when you have all this dedicated time. So I think just go through it, just so you for sure will get through all the questions. And it just gives you more insight. And then the added benefit, if you've taken that shelf early, UWorld starts recycling. They start throwing out bad questions and adding in new ones. So you may have a good handful of brand new stuff by the time you get into dedicated, even though you've completed both of them before going into dedicated, the shelf and the step 2 dedicated UWorld question bank. They're going to have new stuff coming in. So I think that's a good thing to do. Another thing you can add on is Amboss. I know a lot of students that used Amboss. It's a good way to supplement your information. Again, it's another testing company other than NBME and UWorld. They have their own types of questions that they like to ask. And I always felt like I learned weird things that the other two didn't cover. So I think it's good to just get a full view of everything. Okay. Now, for alternative study material, you have YouTube with some really good YouTubers that are good at presenting lectures. I'm not going to give any names because I think there's a ton. You can do Boards and Beyond, Pathoma. You can do that stuff again. If you feel like there's a topic that you're struggling on, you can do video resources. I think step 2 or first aid for step 2 is okay. It's not complete. You can always be asked questions that are not in that, obviously. But it's a good reference guide for quick information. I would suggest having a PDF so you can quickly search other details that, the explanation on the specific question is not giving. So, those are my suggestions with that. Now, how do you get through all this material? It's going to come down to your organization because you're going to be working 8 to 10, whatever, sometimes a 24-hour shift, and having to get through a certain amount of questions. So what I want you guys to do before starting the rotation, or maybe like the weekend before, I want you guys to make a plan of realistically how many questions you're going to get through. Ideally, you want to complete all the questions. Say if it's a 6-week rotation, you want to be done with all of them by week 4. I would say that's a good thing to do so that you have some time to do some add-on questions like Amboss or the step 2 dedicated or more NBMEs, right? Just to clarify anything that you need to go back over. I think that would be a great goal. So take the amount of days that you have and divide it by that, and then just try to hit that number. Now, if the question load is just too heavy, be realistic. And I was telling someone this, and I think this is a great way to describe this. I think the upper limit of how many you can get done a day would probably be maybe like 100 while you're in an easier part of the rotation. I think that like 100 would probably be the max. Any more than that, I don't think is realistic. Seriously. And then I've heard of people trying to do 200 questions a day or something like that, or 300 questions. Now, the way I like to phrase this to people, doing 300 questions a day is equivalent to you being able to like bench press 300 pounds. Okay. Say you're 120 pounds. Physically, it doesn't make sense that you're going to be able to bench press 300 pounds. But for some reason, people think they can get through, like, say, 300 questions. They think their brain can handle that, right? Or their attention. It's just physically not possible. But for some reason, it just seems like, oh, yeah, I can work like that. No. And I think that's something I had to learn, is that you have limits to what you can study in a day, too. It's not just, you don't just have this infinite ability. Just make a realistic plan of how many questions you're going to do a day, something manageable. I think at least 40 is excellent. 60 is really good. Just make that plan that you're going to finish maybe between 4.5 weeks into a 6-week rotation. Gives you a little time to, tweak some things. So there's that. Okay. Now, let's talk about, Firecracker. That's required of you in these shelf exams by SGU. Okay. It's good. It's another thing to look at, but I wouldn't put a ton of effort into Firecracker. I didn't feel like it was as representative of what you're actually going to see in your shelf exam. So I didn't really do any of the flash. I did the flashcards. I felt like they were a waste of time for me personally. My friend did all of them and he did well. So, it's up to you. I think it's just really important to find the testing thing that you like and that you can be consistent with to gather information. Anki. Let's talk about Anki. There's some great decks for Anki. There's tons of them. I know that there's tons that you can find. So just look for a step 2 or shelf exam deck. I think there's Zonky or things like that. There's tons of them. OnKing, that's another. They're good. They're just a good supplement to throw in and just help you study, okay? So when are you gonna get the studying done? Okay, so I think it's very important for you guys to download UWorld or Amboss or Anki or whatever on your phone so that you can do it between patients. In surgery, I had a lot of because in surgery you have scheduled times that you're going to go into the OR. It was really nice because then I knew how much study time I had to throw in between these surgeries. So, I would sit and I'd get my studying done on my computer. And then when I had to go wait in the OR for the attending and the residents, because you usually have to be there early, right? It's good to be there early. I would have it on my phone and I'd be doing questions sitting in the cold corner of the OR and doing my questions. So I would say that's a good thing to have. And even if you're getting like 5 questions, say I was in the OR, I only get 5 questions waiting. That's 5 less than I need to, that's 5 less than I need to hit for my total for the day. So those little bouts, like say if you do that 3 times, it's 15 questions. It's a lot of questions. So if you can do that, it's great. Knock out a few Anki cards, that's great. Okay. So there's little ways to throw in your goal throughout the day. I would seriously encourage you to get all your work done at the hospital so that when you're off, you really don't have to do anything. You can just chill. I know that doesn't happen all the time. I know some people still have to work and get their goal in at the end of the night, but I think it's very important to be focused at the hospital. So, you're fitting in those little bouts of studying. You have like a half-hour break. You can get like 5-6 questions in. You have multiple of those through a 10-hour shift. You have nothing to do when you get home, which is beautiful. That's what you want, okay? That's the ideal. So these are my little tricks, and also just adaptation. That's a real big thing. Just figure out what other people are doing, and if it's working for them, then do it. You can also study with other people. I think it's really about adapting to what works best for you. What gets you to actually study, okay? If it's doing just UWorld and studying UWorld, that's okay. If you like Anki, then throw that in. If you don't like it, then don't use it. Use something else to supplement, whatever information you need to cover. Okay, I know this is a lot. What it really comes down to is just being consistent every day, and don't feel discouraged when you don't get the scores on these UWorld blocks. I think that's a hard thing for a lot of people, but I think this covered a lot. All right, guys. I hope you guys the best of luck, and good luck.